Great. I think we are ready to go ahead and get started. Thank you so much for being here. We're so excited to have today's conversation. Thank you to the Financial Health Network for hosting. Today's conversation will feature the wonderful panelists that are on today with me. My name is Meg Young. I'm a social entrepreneur from AARP Foundation focused in income security. And today's conversation will focus on the impacts of medical shocks and family caregiving on lower income older adults. And with me is Craig Antico, co-founder and COO for RIP Medical Debt, Devin Boddie, program associate from the Financial Security program at Aspen, Lindsay Jurist-Rosner, CEO from Wellthy, and Mark Rukavina, the business development manager from Community Catalyst, Center for Consumer Engagement and Health Innovation. And each one of these panelists will be able to share in the next few minutes a bit more about who they are and what they do. But before we get into that, the next conversation will feature a bit of background for those of you who may have joined the previous webinar in this series on fixed incomes, especially for those moving towards rethinking their golden years. So highlighted in that are these human-centered stories of research participants that through this video series presented by Financial Health Network really follow the stories of people either, as we'll talk about today, going through a caregiving conundrum, experiencing medical shocks, living on fixed incomes, and we highly recommend revisiting some of those stories after today's webinar. I will speak to a couple of those quotes, and I know the panelists have watched those videos as well. So to get us started and looking at more of a macro scale of what the problem is that we're talking about today, there are over 56 million low to moderate income older adults in the United States today, 13 million of which are struggling with all or nearly all of their aspects of their financial lives. In terms of the percentage of income that is spent on healthcare for the lower income older adult, that tends to be right around 20%. And the typical cost of caregiving services or solutions can exceed 30% of a family's income. And among those who have struggled with household medical bills in the past year, both insured and uninsured, more than 1 in 3 report difficulties in paying for basic necessities such as food, housing, and heat. So in thinking about these financial lives that we're seeing in these videos, there's 2 in particular that really stick out for our conversation today and that we'll speak to. But episodes 3 and 4, talking again about caregiving and medical shocks. As an example from one of the research participants, Kathy, age 64, we heard, I ran into medical debt, $50,000 without health insurance. It's not hard to do. You just can't be without health insurance and you need food and roof over your head. So it's a struggle. And Valerie, a family caregiver, age 57, we heard that she really doesn't have time for herself and that it's a never-ending story. So today we have 4 panelists who offer solutions to address the stresses that older adults face as a result of medical shocks and caregiving. And to my panelists, I would say we are in this moment where the stress of both medical shock and financial strain of caregiving has become part of our national narrative in a way that's previously unseen due to COVID-19. We've also seen a disproportionate impact on older adults and people of color, especially as they play a key role in providing our essential services, including home health care. Would you please introduce yourself, your company, organization, or work, and talk to us about how you're working to address these stressors that impact the lower income older adult population? I'd love to start with Devin Boddie from the Financial Security Program.
Hi, good afternoon, everyone. My name is Devin Boddie, and I work for the Aspen Institute Financial Security Program. We are a research nonprofit based in Washington, D.C. First, I would just like to thank the Financial Health Network, Meg and Sarah, for inviting us here and having such an important discussion. And where I fit into this entire discussion is last year, Financial Security Program partnered with Citi to do an extensive research process on the issue of care and exactly how it impacts household financial security. So last month, we released a report titled The True Cost of Caregiving. And in that report, we find a couple of things that are really highlighted throughout the videos that the Financial Health Network has put out. First is that caregiving is a universal need. Everyone will need caregiving at some point in time, whether it's for infants, adults, or elders. Second, we find that the typical cost to purchase these caregiving services can easily exceed 30% of a family's income. And this is in addition to other expenses such as housing, healthcare, education, and debt services. So it's really important and impacts people's ability to earn income, accumulate assets, and save for the future. So I'm looking forward to discussing these issues with our panelists and talking more about just important things. Yeah, thank you.
Thanks, Dyvonne. Now to Craig from RAP Medical Debt.
Hi, I'm the co-founder of RAP Medical Debt. We are a charity that buys medical debt in bulk and then abolishes it. So we buy it or take it in as a donation. We've noticed that in the collection business that I used to be in, I used to be a debt buyer and a collector in the healthcare space. And we used to buy accounts from hospitals and doctors groups. And we noticed that over 30% of the accounts that we got actually qualified for the charity care from the hospital. And this is also for the elderly too. I mean, and we're finding that a tremendous amount of people get debt right before they get Medicare. It's really just a shame. They're just very close to getting it, but they also don't understand their insurance. And we also get tens of thousands of letters from people asking for help. So we have a lot of understanding of what's going on with the elderly and the low income.
Great, thank you, Craig. And now to Mark from Community Catalyst.
Thanks, Meg. Thanks to the AARP Foundation and to the Financial Health Network for sponsoring today's webinar. As Meg said, I'm the Business Development Manager at the Center for Consumer Engagement and Health Innovation at Community Catalyst. Community Catalyst has been working since 1998 to build a consumer health advocacy movement. We work with local and statewide consumer organizations in 45 states across the country to ensure that consumers have a voice and a seat at the table where healthcare decisions are being made. The center's focus on health system transformation. We work with our consumer partners to address health inequities and design consumer-centered care, in particular focused on underserved populations and those with complex social and health needs. I wear a second hat. I'm also the director of a community benefit and economic stability project that we just recently launched. And the Financial Lives videos clearly illustrate the struggle that millions of older adults and others face, in particular those with limited financial resources. And as noted by the foundation president, Lisa Marsh Ryerson, poverty is not an individual failing. Rather, it's a societal problem. And we at Community Catalyst work to advance policy to protect people. We're fighting to protect and expand the Affordable Care Act and access to affordable coverage and affordable care. We also work to address medical debt, so there are fewer of those accounts that Craig and his organization have to deal with at the end of the process. So delighted to be on today's webinar. Thanks.
Thank you, Mark. And Lindsay, last but not least, Lindsay from Wellthy, please.
Sure, I'm Lindsay Jurist-Rosner, and I'm the CEO and founder of Wellthy, and I always have to spell the name of our company, so it's W-E-L-L-T-H-Y. And the mission of the business at Wellthy is that we've set out to help caregivers, so those taking care of aging, chronically ill or disabled loved ones. We work with employers, so companies cover the cost of our service as an employee benefit, and we feel very strongly about being able to support working caregivers because, and we'll talk more about this in our conversation today, but one of the things we see is that caregivers far too often are stepping out of the workforce because of their caregiving duties and forgoing their careers, career advancement opportunities, and it's very hard to return to the workforce after taking a leave or some time time away. And so we're very proud to work with big name employers and small companies, and we support all types of workers and workforces, including shift workers, hourly workers, individuals who live in multi-generational households and are taking care of parents and in-laws and grandparents and children and struggling to pay bills, let alone pay for and cover the cost of care. So excited to be here with you all today and looking forward to the discussion.
Thanks so much, Lindsay, and to all of the panelists for joining. It actually, in some ways, Lindsay, what you touch on of, feeling really strongly about caregivers remaining in the workforce and supporting them by providing those services that are most essential to them, actually flows really well into our next discussion topic, which is really acknowledging that the workers who continue to provide either essential services, including home care workers, and this can extend to other areas of opportunity as well, is that these, the majority of whom are, especially during the time of COVID-19, are typically Black and immigrant women of color, are in many cases the only lifeline to some of the most vulnerable people in this virus, older adults, people with chronic illnesses, who rely on these caregivers for food, medications, essential activities of daily living, and for human connection. And be that a paid or unpaid family caregiver situation, these workers are barely able to make a livable wage, and many of them have to take time off as they do so because they do not have the protection they need to do the work that they do. And we saw this not only reflected in those stories from the Financial Lives After 50 Rethinking the Golden Years videos, but I'm really curious how these stories resonate with each of you and how you're working, as you've already started to allude to, in bringing in some of these human stories and experiences into your solution and project design. And I'd love to start with you, Lindsay, as you were just starting to, I think, speak to this in the design that Wellthy has in its relationship and market, but would love to hear that in more detail.
Yeah, sure. Happy to start. So we feel very strongly, and from the founding of the business, we were focused on what we felt was the missing piece for caregivers. And it's the founding story of the business is based off of a personal story of mine. I was involved in my mom's care for 28 years. My mom got diagnosed with primary progressive multiple sclerosis when I was 9, and I was involved in her care all through my 20s and 30s. And, the thing we see with caregiving, we saw this in the videos, is you don't choose to become a caregiver. You don't have any preparation, background, expertise, and individuals find themselves overnight in these caregiving situations where they're responsible for the well-being of their loved one, and it's tremendously difficult and stressful, and impacts all areas of that individual's life. And we do see, various differences, to your point, Meg, in cultural backgrounds. There are certain, in certain cultures and in our society and around the world, it's not acceptable to find a long-term care facility for a loved one, or maybe that doesn't feel like the best option. And so we see various viewpoints and societal pressures and personal pressures. We still see that caregiving is mostly a women's issue. And so as you talk about the impact of caregiving on essential workers, we also are tracking closely and very thoughtful about the impact of, especially in this moment in time, as schools don't reopen and kids are doing remote learning, we're seeing families struggle with caregiving and kids in the house and trying to work from home. And we're hearing in the data that it's especially women who are saying, hey, I might just need to opt out. I might just need to take a leave of absence, take some time off from my career. And so we're really concerned about the impact of care needs on keeping especially mid and senior level women in the workforce. But yeah, we've been very mindful about this kind of caregiver-centric design from the beginning of the business. We listen very closely to what caregivers' needs are. And the solution we've built is really about providing project management for families. So what we identified that's missing in the healthcare system is the notion we know from business as essentially project management. In any complex project in your life, if you're managing your money, you're going to consult a financial advisor. If you're doing a home building project, you try to get a general contractor. It's the same notion. This person who is your partner, your healthcare project manager, your expert, your guide, and can help get stuff done. And we really do see, especially for lower income families, a lack of empowerment to ask questions or push healthcare providers or services to see if they can get better care or better access, whatever it may be. And so we feel strongly that families need that support, that representation, that advocacy. And so that's the role that we're playing. And we do a ton of listening and a ton of learning and iterating. And as a startup, we can evolve as we grow.
Thank you. It's so great to hear too the term caregiver-centric design. It's something that I think we often try to really focus first on who we're designing for before we get started in any policy, nonprofit, private sector solution that we may be working on. So really, really helpful context there. Devonne, I'd actually love to turn to you also on the caregiving front. I know that especially through the lens of equitable design practices, that this is something that you've looked at quite a bit, and would be curious how, when you reflect on these videos and or the stories of your own research, how you start to see those roles play out for the caregiver population, either paid or unpaid.
Yeah, and just hearing about what Lindsay is doing at Wellthy, it's really an interesting dynamic, because as much joy and empowerment that people may find in being able to care for their loved ones, it also comes with financial burdens and personal sacrifices. So I'm just really glad that you guys at AARP and Financial Health Network are lifting up these stories. But in our research, we're also finding that families aren't the only ones who are struggling within our care system. So today, professional caregivers, which we define as direct care workers, home care workers, even child care workers, they're among the lowest paid workers in the nation. Some don't have access to modern labor protections. Some don't have access to modern workplace benefits that many of us enjoy. And we've also found that approximately half of all professional caregivers rely on some form of public assistance just to meet their daily basic needs. So something that we've been asking ourselves is, if caregiving plays such a crucial and important role in our everyday lives, why are the workers in this sector so vulnerable? And really, what I've seen through research and just through history is that caregiving has a history that is deeply, deeply inseparable from racial and gender disparities, kind of like what you guys were saying earlier. So for women were and continue to be prominent in caregiving roles. There are so many studies that back this up. And these functions have historically been underpaid, undervalued, and are also disproportionately made up by Black, Latina, and immigrant women to this day. That's also something that we've been seeing with COVID and with domestic workers not being able to earn income because of just the risk and the impacts. So another thing that we've been asking ourselves at FSP is, how can we design an equitable, affordable, and quality care system that not only benefits families, but benefits care workers as well? Because we have to look at the care system as a whole, not just the people who are receiving the care, but the people who are giving the care, whether they're paid or unpaid. So a couple of solutions and policies that we've been looking up is just, one, uplifting policies that ensure a livable wage or increased minimum wage. This is something we've been hearing a lot during the pandemic, but this is critical in closing gender and racial pay gaps as well. Secondly, it's just equal access to benefits. So paid sick leave, paid family leave, paid medical leave, particularly for part-time workers, lower wage workers. These are all very important. And these don't just have to be employer provided. We've also seen some very innovative portable benefit models. One that comes to mind to me right now is called Aaliyah, and they provide portable benefits to domestic workers. So that's just a very interesting product that I've been seeing. And then third, just inclusion into modern labor protections that we all enjoy. 9 states have implemented a domestic workers bill of rights, and that addresses paid overtime, work conditions, workplace harassment, and especially discrimination, which is also very important since this sector is predominantly made up of women of color. So we just don't have a domestic workers bill of rights at a national level. Why is that? So overall, just looking at how all of these things play together and intersect, and we've come down to just there's just a lack of family policies And amid rising costs, that creates the care systems that relies on, one, an underpaid workforce, and two, it really forces families to shoulder most of the cost burden. So that's what we've been coming to.
Such an important dialogue and conversation. I think, Dyvonne, one of the things that comes to mind for me right now is, and I know we'll talk about this more in our conversation, but just the latest introduction of new stimulus and how that's being proposed and what that means for especially self-employed people and people who are maybe in domestic work or other forms of work that are non-traditional, and the impact that that has, and also the gaps that are just so clearly there in what is necessary and needed for domestic workers. Thank you so much for going through also what Aspen is focused on in terms of, in the financial security program, in terms of an equitable care system. Mark, I would love to turn to you because we're similar in this conversation of focusing on this population that is disproportionately impacted, either along racial lines or other in terms of income level. I would be really curious how, as we're talking and reflecting on these videos and these human-centered stories, the work that the Community Catalyst Center is doing, I know you've mentioned in the past around even disaggregating data and looking at analyzing for impact on particular populations.
Thanks, Meg. I think I was on mute there for a second. Apologize for that. Yeah, I want to echo what Lindsay and Dyvonne said. It's really important. We've got a workforce that's underpaid, undervalued. I think we're dealing with structural racism in terms of that workforce, and those are issues that obviously need to be addressed. The same applies for those receiving care. And you know, we at Community Catalyst and at the center really focus our efforts on consumer or community-driven programs and policies that address coverage and financial barriers to care. I mentioned this new project that we're initiating. We'll be working directly with consumer groups that are operating at both the statewide level and the local level in 3 or 4 states to address issues related to unaffordable care. So it's human-centered design at its core. We're going to be working with hospitals and health systems, looking at their policies, encouraging them to disaggregate the data, as you said, Meg, to really look at, you know, who is it that is saddled with this unaffordable medical debt? Who is it that is being pursued in terms of legal actions taken to court? For example, looking across race, ethnicity, and other historically excluded groups. I think it's really important, especially in light of the public health pandemic that we're in the midst of right now and the economic crisis that's resulting. And in the wake of the murder of George Floyd, to really examine whether or not this is disproportionately affecting certain populations. That's what we'll be doing. We're going to be working in conjunction, as I said, with hospitals, health systems, providers, pursuing both institutional policies and possibly public policy as well that address these issues. I think Craig mentioned this earlier. So many people, and the videos bore this out, are unaware of consumer protections that exist, are unaware of programs that they're eligible for. There's a lot of confusion right now. We've got attacks in courts on the Affordable Care Act, confusion as to whether or not testing and treatment is covered, for example, for insured, for underinsured, for uninsured people. So public education is really important. Our focus is really to ensure that those protections are in place and that there's a strong consumer advocacy infrastructure that's also calling for policies that respond to the needs of community, in particular those most vulnerable.
Fantastic. And it seems like such a great segue to Craig to talk about it from the perspective of seeing these, you know, thousands of letters of consumers who are dealing with medical debt and struggling with finding a solution that meets their needs, and perhaps lack the awareness of those very programs that you're talking about, Mark. But also, Mark, just so excited to hear about some of the grassroots work. It sounds like at the community level, really focused on designing with and not for these populations, which is also very exciting. But Craig, would love to hear your perspective as well.
We're only 6 years old, but we've constantly tried to design our service around the person. However, it's very difficult when you're buying millions of accounts to think about the individual, because we can't buy debt of an individual. We have to buy it in a portfolio. So we inform ourselves by doing research. We've gotten research with MIT, University of Chicago, UCLA, where we're looking at abolishing debt and how much debt affects these people. You know, how does it affect their wellness, you know, mental wellness, physical wellness, and also what's the economic impact of this debt. Now, what we do is we add a tremendous amount of data, so we will be able to tell the world, hey, the population of Blacks is X, but the amount of debt that we've abolished for them is 30% of our 1.5 million people that we've helped. We're not going to target debt like that, but we are going to look at it retrospectively and see what the issues are. So we don't have, from all those people that write us, what their ethnicity is, their race, religion, anything like that. But in retrospect, I can tell of the people that we abolish, or even the people that we have that we can abolish debt for. Now, what we're doing with the hospitals, we've just gotten the okay from Health and Human Services, OIG, to actually go to the hospitals and buy or get debt donated directly to us. Now, that's going to give us a chance to do some even more work, because we'll work with their population health group. We'll add social determinants of health data to our the debt that we can buy or qualify, and that will end up helping us focus our efforts where they're most needed. You know, that's what we're trying to do, is make sure the donor's money is going where it's needed, and we can focus it on geography or group or others. So that's how we're trying to design it in a way that helps these people.
Fantastic. Before we move on, I would love to dig in a little bit more to what we're discussing right now around especially the financial implications for people in this underinsured or uninsured population. But before I do, any last thoughts related to this human-centered design that we're talking about, or speaking to what either any of your co-panelists have shared? All set. Okay, we go on. So I'm really interested in something that we had just alluded to a few minutes ago, and I'm sure those listening would also be quite interested in your perspectives on this current moment in time. So we look at unemployment claims, we look at what's going on in terms of traditional job loss and the impact that has on coverage, insurance, access to benefits, and ultimately what that means for what at both a policy level, but then also in other areas we may do and I'm thinking about this specifically in the context of AARP Foundation, what we might do perhaps if we're not directly involved at a policy level, but thinking about this social safety net, and what we've seen is over many decades now a kind of shrinking social safety net. But especially during this time of COVID-19, something that you've all discussed is how your organizations are starting to work and support this. And I think, Dyvonne, you spoke brilliantly to this in talking about the solutions around an equitable care system and what some of those opportunities may look like, or pillars of that may look like, that are lacking today, whether that be in portable benefits or just the expansion of necessary labor protections that don't exist for a workforce today in both professional caregiving, and then I would say also in probably other forms of employment as well, for especially the most vulnerable populations. But again, for those of us who do not work perhaps in the policy space, how might what you're learning still inform and improve our work as it relates to this? And I'd love to start, Mark, with you, as I think you have perspective on the coming potential stimulus, as well as other areas that might inform our own solution design. And then I'd love to open it up to the group.
Sure, thanks, Meg. Again, first and foremost, at Community Catalyst, we're fighting to protect, preserve, expand the Affordable Care Act and all of its programs, really encouraging the states that haven't done so already to expand the Medicaid program, a valuable safety net for millions of people being taken advantage of by millions of people who've lost their jobs during this economic crisis. That makes coverage and care available to people across the country. Again, we have 13 states that haven't expanded it, making insurance more affordable for those who don't have the benefit of employer-sponsored coverage. So making sure that the public subsidies are there for people to buy private insurance on the health insurance marketplace. Looking at, capping insurance premiums as a percentage of household income. These are some of the policy solutions we're looking at. In terms of solutions that could be helpful or technology that could help with this, I think, better, more effective screening of people for existing programs, whether it's insurance coverage programs or institutional financial assistance programs, the kind of programs that Craig mentioned previously, and really using technology to screen out people that really shouldn't be pursued for payment because they have little or no financial resources. And it's not worth the time and effort of the healthcare provider to try to pursue those people for payments. Rather, they should be looking to see whether they qualify for a public program, for example, or some other program that might exist in their community. So, we think it's critical to partner with consumer-based and community-based organizations in doing this work. And, excited to hear what some of the others on the call are thinking about as well. But, so many people are unaware of programs that they could benefit from. I think that there's probably opportunity there to use technology to kind of relieve that friction that exists.
Yeah, I saw Craig. It looks like you're,
yeah. One thing I'd like to bring up is that I talked about that 30 to 35% of the people that don't get the program, the charity care, when they really should have gotten it. Well, people do opt to not get it. They're proud. They don't anticipate it's really going to hurt them, the money that they owe. But there's other reasons too. I never advocate for certain policies, but so I'm not talking from RIP's perspective, just my own perspective. If it was an opt-out policy, which meant that people that qualify automatically got the charity care, and if they wanted to opt out of it, they can, but they at least automatically get it, because then we wouldn't have this problem. I think about $150 billion a year of the $200 billion a year that's left over after insurance pays and the people can pay what they can pay is because they didn't get charity care. And if we gave it to them right away because they qualified, they'd be much better off. Or if they got Medicaid. I worked with AARP about a year ago, and we were on a panel trying to decide what should we do with this case here for financial insecurity. And it turns out that there was nobody that ever had problems when they had Medicaid, like ever. They never had a medical debt issue, and it's the best insurance out there if you're resource challenged. It's the best.
Thanks, Craig. I wanted to make a quick note to the attendees today. If you have any questions as we're going through, we have a final question for our discussion. But before we get to it, I just wanted to make a quick note. In the chat window, feel free to send any questions that you have to the Financial Health Network. They will be checking that chat box and posting those questions for us to get to in just the next couple of minutes. But before we move on, Lindsay and Dyvonne, I just wanted to ask you if there's any additional thoughts you have as we talk about what the social safety net means for especially the paid and unpaid family caregivers, and in what ways can you think that this group of people should be informing or designing for solutions for those needs?
Yeah, listening to Craig and Mark talk about this, I strongly agree with what they're saying. Insurance status is strongly associated with medical debt, and all forms of debt have just very close connections to mental health and physical health as well. There's been a lot of studies that show that, especially from Kaiser Family Foundation. But what we've been focusing more on is what can be done before to just mitigate these damaging impacts. So what I'm thinking is just greater advocacy around employer and government provisions for long-term care, or what others call long-term supports and services, LTSS. It's important now, but also for the future, because we're seeing all of these reports from BLS and other agencies that show that the share of adults age 65 and older is expected to double in the next 40 years. And the demand for long-term care is expected to increase by 36% in the next 10 years, according to BLS. So there's going to be this growing demand for services that isn't being met right now. So how can we make sure it's going to be met in the future? Also, Black and Latinx people and women of all races are more likely to have greater long-term care needs and fewer economic resources to meet those needs. So there's just an obvious gap there. And from a policy perspective, kind of similar to what Mark was saying, just access to federal and state insurance programs should be expanded. So programs like Medicaid, Medicare, Social Security insurance, Social Security disability insurance. I'm not an expert in these programs, but I do know there are very strict eligibility rules that keep people from accessing these different insurance programs. So we need to do something about that so that families can have more access to subsidized care. And for families and individuals who aren't eligible for subsidy, what I've been hearing a lot is that it's important that people are able to pre-fund or insure against risk for future long-term needs. So only about 30% of working adults have access to long-term disability insurance through their employers. Only about 15% have access to long-term care insurance for themselves or their families, also through employers. But I've been seeing a lot of good examples of states providing these things. In 2019, the Washington state was the first state in the nation to enact a state-run long-term care insurance benefit. And I've even seen examples from Hawaii. They have a Caregiving Assistance Act that provides a stipend to individuals who care for elderly family members. So these are just different ways, different policy solutions and examples that I've seen federal and state, that I've seen states do and enact to help caregivers and to help older adults manage these costs and manage these, there's these future health needs. So it's all very interesting.
It also, I'm curious, Lindsay, from your perspective, especially being so tuned into the employer channel, what you're seeing in terms of innovation in that space and providing these necessary services like what Wellthy does to this population that so desperately needs assistance.
Yeah, so building off Devonne's point and Mark's point as well, it's what we hear from families is exactly what they articulated, which is that families just don't know what programs, what resources are appropriate and available to them. And you think about it, right? Like, we have the largest aging population we've ever seen before in history. Devonne pointed out how that's going to grow and change. And these folks will live longer than ever before with more complex care needs. And the issue is, you know, we're talking about financial hardship and low-income individuals, but keep in mind, I mean, there are Americans who are saving for retirement and will go into retirement with resources, but will outlive their savings, right? Like, that's a very real reality of what we're seeing with the families we support, is that, you know, older adults are getting to their 80s and 90s and just have outlived what they've saved. And so, you know, one of the things we see is just that the biggest thing we hear families coming to us and saying is, you know, does Medicare cover an in-home aid? How do I go about setting that up, right? Like, there's just a ton of confusion around what's covered and how to access care. You know, 90% of long-term care is actually handled by families. And so it's, you know, there isn't a lot of resources today. And so we're navigating for families and helping them understand what Medicare covers, what Medicaid covers. 50% of people who are eligible for veterans benefits aren't receiving benefits from the VA, right? So navigating and applying for these benefits is really challenging and requires a lot of steps and having access to a lot of information. And so we're hand-holding families through that process. So I agree with all the points that are made. I mean, I think policy is one thing, but there are a lot of resources out there. It's just getting the right resources to the right people at the right time, which is really one of the challenging aspects.
Such a great point. It actually flows really well into what we're talking about next of helping people at the right time. I'd love to transition into a conversation around how we navigate the stress. You know, we've talked a lot about what the challenges are, perhaps the barriers to receiving the benefits that you need at the time that you need them, whether you are the person giving care or the person receiving care. But just navigating the actual stress and the impact that we see, especially on the caregiver end, with I think almost a quarter, right, that are experiencing some form of stress in the role of their job and have actually said that caregiving has made their health worse. And so I'd love to, especially between Lindsay and Dyvonne, open up this conversation. And Mark and Craig, I'm sure you could add more as well. I do want to do another quick shout out. If you have any questions, we'll be moving into the Q&A in just a few minutes. So be sure to put those in the chat.
Yeah, so one thing that we're always saying in the financial security program is that short-term stability leads to long-term security. So for me, it just comes back to advocating for family policies and prioritizing racial and gender equity and policies that can help families in the short run. And this is also like a fundamental theme in our report, The True Cost of Caregiving. But just going back to the racial and gender dynamics, you know, today women's earnings play a greater role in family incomes than ever before. And we've seen them become increasingly important for financial stability, for retirement security, for the economy as a whole. Yet women still face stark disadvantages in terms of affordable access to care and parity in the labor workforce and hours spent with caregiving, and then that just all accumulates to just these greater burdens for mental health burdens and stress burdens and social isolation, like you were saying, Meg. So it's very important to apply a gender lens in all of this, but also the racial lens. Just Black, Latina, and immigrant women are more likely to be the primary source of economic support for their families. So just thinking about that as well, are we making sure that the jobs that they have are providing enough support and assistance for them to not only work and earn income, but to take time off to care for their children or care for aging parent, or if they themselves have problems, health problems, do they have the supports to be able to, you know, care for themselves and not lose a bunch of money and not be displaced from the workforce? So those are all very important things. So I think in my mind, like the top three policies are increasing access to affordable care through federal, state, and state subsidy. Second, increasing access to benefits like healthcare and paid leave. And then third, just policies that support a living wage, whether that be $15 minimum wage or other types of assistance in that form. And there's evidence that is building that an equitable, affordable, and quality care system, and not only benefits households, but it benefits the economy. That's why we've all rushed to these policies during COVID. The benefits include improved workforce participation, economic productivity, childhood and development outcomes. It serves as a multiplier effect into the future. This is especially important for communities of color. We see improved health equity for minorities and reductions in poverty. So there's just so many benefits to making sure that we provide an equitable care system, provide assistance and supports. And with school closures and childcare closures and risk of illness and increased unemployment, COVID has definitely just shown us the importance of supportive care infrastructures and making things affordable for people. So like we saw in those videos, people can just live their lives and be in the best health that they can be and just benefit society to the best of their ability.
So great. I keep nodding along because I just completely agree. Lindsay, I'm wondering if you want to piggyback on anything Dyvonne just said from your perspective at Wellthy.
I think she covered so much great ground. I would just add, you know, one of the things that we see in the families we support is that there's a real gap in individuals self-identifying as caregivers. It's not really, the healthcare system and policymakers, we talk about caregiving, but most caregivers just consider themselves daughters or mothers or sons or wives or husbands. And so one of the things we've found when we work with employers and we support employees, that we don't use certain terminology. We talk to, are you taking care of a child with special needs? And let's talk about what that entails and how we can support. So being very specific about the language, and then very specific about kind of the ways that we can support the folks who are dealing in those caregiving situations. So that would be one point that I would make. And then, yeah, I mean, on the kind of policy side, I think we need more state infrastructure, federal spending, state spending, infrastructure awareness. But I do think kind of the biggest issue is just raising awareness. And there's an organization called Archangels run by Alex Strain, and she's doing phenomenal work with Walmart and Prudential in just raising awareness of caregiving. What is caregiving? Who are caregivers? Are you a caregiver? What does that mean? And what are implications of caregiving on your own health and well-being, your financial wellness, and future financial, future financial well-being? I mean, just talking about this as a topic, it's just a missing, a missing kind of part of the national dialogue that I think we just need better awareness around.
Couldn't agree more. And I know we don't have too much time left, unfortunately, because I have a feeling we could go on for a long time. There's so much to work through here. But there are several audience questions that I want to start getting to. So I'm going to transition over to our Q&A. And our first question, I think, could be answered by anyone in the group. So all panelists welcome to answer this one. The panelists all talked about the complexities of navigating insurance, what's covered, what's not, the process of applying, understanding the complexities. What is your advice to help people make sense of all of this to make the right decisions?
Well, I wrote a book called End Medical Debt. And in it, I talked about all the mines, the landmines that are out there that are causing all this debt, which of course would be prevented if they maybe, they need to get educated. They need to go and understand their policy if they have insurance. They need to understand that if they don't have insurance, they have to be charged what's usual and customary, not this rack rate like that's on the back of your hotel room, $500 when you're paying $150. They have to understand the out of network. There's very narrow networks that you're in, and if you go out of network, you can just be devastated. So it is a big education. So we need a healthcare, insurance, and non-insurance education.
I'll chime in and just say, I'll push back. Craig, I hear you. I agree completely that more education is required, but I'll push back and defend the healthcare consumer. What's challenging is plans change every year and care needs change every year. And it's completely daunting for Americans to understand what their health plan covers and doesn't cover as they're sick, as they're stressed, as they're dealing with financial hardship. So I think it's a lot to ask American consumers, to put it on American consumers that they should be the ones to try to figure it out. I think we need to, as a society, provide more resources for families, almost kind of that advocacy role to provide free or covered support to help families navigate their options, make the right choices for them based on their care needs and financial situation and family dynamics, and not put it on the healthcare consumer to have to make those decisions, without any background or expertise on the topic.
I'd like to just jump in and just echo what you said, Lindsay. Our organization supports navigators and assisters that help people who don't have employer-sponsored coverage enroll in the health insurance marketplace plans, and tries to explain, work to explain those plans to individuals. Because for people that don't have employer-sponsored coverage, it can be really challenging. So that's really important. The previous administration funded navigators and assisters at a level that we don't have under the current administration, hopefully going forward, and especially in the midst of this pandemic. hopefully will recognize the importance of that role. And it relates to something else Lindsay said, which is people's kind of awareness of their plans and the changing plans that people struggle with. And that relates to surprise medical billing, another issue that I think is, really kind of a challenge for many people who, may have had a certain type of coverage previously, or maybe even the very same coverage previously, and all of a sudden are being billed for things that they in the past hadn't been billed for. So I think there's a lot we can do. Technology can be helpful to this as well. It has been. Hopefully we'll move to a place somewhere in the future where we've simplified this for all people, irrespective of whether they have employer-sponsored coverage or are buying coverage on their own. You're muted, Meg.
Thank you. Had to happen at least once. There's another audience question I was just about to say that is actually somewhat related, a little bit different though. So outside of government insurance or employer benefits, where else could organizations and companies be sending older Americans and their caregivers for help? So I know, Lindsay, you just mentioned a larger awareness campaign through Archangel. I know AARP, we're really focused on bringing awareness to potential solutions as well, but I would love to hear all of your perspectives in terms of both the caregivers and then those that they care for in finding additional resources or help.
There is the 211 network, which is, I've learned about that. They're not all the same, but it's kind of like 911. You dial 211, and 98 or 96% of the whole country is covered by these 211 systems. And you can call them about any health and human service or even a disaster question, and they will refer you. Some of them will create a case and actually make sure that you're getting the service that you need. Those would be very helpful, I think, to some of the caregivers and the care receivers.
And just a couple of orgs that I came across through my research. First, the National Alliance on Caregiving. They have resources on resources. There's such a great network for caregivers and for people who do need care. So I would definitely suggest checking them out. Genworth, they have an entire website that helps you estimate long-term care costs, and it's an award-winning website. It's really cool. I suggest people check that out. And just a piece of legislation that has been in the rounds, the Raise Family Caregivers Act, advocacy around just lifting that up. And I'm actually not sure if it's passed yet, but it identifies actions that communities and healthcare providers and employers can do to support family caregivers. That includes like respite options, workplace policies, information sharing and training for family caregivers. So definitely advocating for that type of legislation to go through.
I mean, I'll put a plug in for my company, Wealthy.com. And just, every state has a state-based Department of Aging that provides resources, the other resources that folks mentioned here. But there's thank goodness for Google. I mean, there's tremendous, to Devonne's point, there's really phenomenal little bed and breakfasts that specialize in respite care for caregivers and offer really deep discounts and really great programs, and plenty of other kind of local community-based programs. So it's a matter of kind of looking for it and knowing where to look. But yeah, if we can be helpful, Wealthy.com. And we've developed a care framework. So we have 6 pillars that we walk families through that are areas of consideration that every family with complex care should think through: legal, financial, in-home, housing, medical, and social and emotional. So we have a ton of resources for free through our site as well.
Thank you. It's so helpful, especially as we talk about of those pillars, the emotional pillar being the one that I think touches on all of us, especially as we talk not just about the family caregiving experience, but also just this reality of COVID-19 and the state of things right now as it relates to addressing both of these factors of medical shocks and family caregiving. So great to hear that. Thanks, Lindsay. I think we only have about 3 minutes left. So what I'd love to do is actually close with asking the panelists if there's anything else that we haven't covered today that you would like to address before we wrap up in the next minute or so.
Well, one question I have is that what are we going to do when right now the free care from mothers and daughters and so forth is given? You know, I think AARP says it's like 35 billion hours a year. When now the aging population means that we have less people to take care of the older people, how the heck are we going to pay for that? Or if we do pay for that, how are we going to pay for all the other things that we're paying for? So, you know, and there's a shortage of caregivers right now. So how in the world are we going to get where we need to go if these are, you know, systemic issues that will not change? So
Well, I'm not going to respond to that, but if I could add one other point to your question, Meg. The federal government's poured trillions of dollars to shore up families and the economy. We need more accountability with those funds, and stimulus checks have been sent to individuals around the country. There's new legislation was just introduced yesterday by Senators Van Hollen and Murphy. It provides protection for medical collections. It puts an end during the pandemic, the public health crisis, to legal collection actions, and puts an end to attaching bank accounts, for example, that these stimulus checks might be deposited in. So that's an important step, really important to address the issues that were highlighted in the video of people who have healthcare bills that they're really, really struggling to pay. So I just wanted to take advantage of the opportunity to inform people of that legislation.
Thank you. And I think in some ways it speaks, Craig, to your question. And I know we're right at the end here. Craig, I think we could probably talk about your question for quite some time, of the number of ways, but I think the one that comes to mind, or just volunteering one thought before we go, is actually to echo what Dyvonne had shared earlier of these kind of 3 areas of focus and value rendered through increasing access to care through subsidies at a federal and state level, improving both awareness to our conversation around the lack of awareness around eligibility of programs or just benefits in general, increasing access to those as well. And then lastly, policies that support at the minimum a minimum wage. And I think related to that is also the labor practices that need to be in place to support that. But I know we're at the very end here, so I just want to thank everyone for joining. This has been a tremendous conversation. For those that had questions that we didn't answer, we'll try and get back to you. And I want to lastly thank the panelists for joining today for this conversation. There will be a recording of this conversation available on the Financial Health Network.